And so this year has been a little different. COVID definitely has added barriers to the in-person part of going to Frankfurt. I see some familiar faces on the Zoom tonight. Elwood specifically has always come with us to lobby in Frankfurt, but we've shifted a lot the last 2 years to more digital advocacy, so that we can still meet with our legislators and we can still have conversations with them, holding them accountable. And one shift that I have seen this year that is promising is that more Republicans are willing to sit down and meet with us even over Zoom. And so I'll talk about ways that you can participate within that process, because the biggest victories that we've seen, or that I've seen at least I can speak to in the last few years, is when we come together, share our stories, we see needle movements. And when we look at the coalition effort to enact a buffer zone, like with a safety zone down at EMW, it was stories, it was patient testimony, it was clinic escorts advocating for years that saw the completion of getting that safety zone enacted. And this really does happen with your stories and your advocacy helping to push us past that needle, because I can meet with legislators every single day and I see very little movement. But it's when I bring you all with me, the constituents, they're somebody that's not a lobbyist, that's not seen as like a political figure of an organization, we see movement. And we are really excited about, we have about 20 bills, proactive bills, that we're actually working on with the Women's Democratic Caucus, that address maternal and infant health, specifically barriers to care. And so bringing down different blocks that are put up in the state, like access to birth control, something as simple as giving somebody the ability to pick up 12 months of birth control, really can be a game changer when reducing unintended pregnancy. We know that 1 in 4 women say that it's because they can't get to the pharmacy in time that they stop taking birth control. They miss one dose and then they fall off, and they may fall off for months, they may fall off for a year. And when you're looking at a state like Kentucky, and we can address, some of the systemic barriers that go into reproductive justice, because this is a tenet of that, 67% of the counties don't even have access to a practicing OBGYN. And so when you start to look at the barriers to care, they're already having to drive. Most health departments do not offer full service screenings and birth control options. If somebody wants an IUD or an implant, they may have to drive 2 to 3 hours to access that. So that's a barrier to care. And even picking up birth control can be a barrier. Let's say you're in an abusive relationship and your partner will let you go out maybe once a month to buy groceries when he's with you, but once a year when you go to your gynecologist for your yearly, they'll let you go alone. If you can pick up your year's worth of supply in that moment, you're protected against any restrictions that an abusive partner might put on you, or limitations to transportation. If you can't afford a car, if you don't have a car and you can't drive to the pharmacy every month or get a ride, or the bus routes keep changing, or a pharmacy, as we've known through COVID, pharmacy hours keep changing, and access to medications. My medication, even that I take, I keep getting delays on. So imagine that for somebody in a rural community who's counting on picking up their birth control, but it's constantly things are constantly changing and pushing them away from access to care. And so we do have one bill, House Bill 300, that Representative Raymond filed to have insurance cover a year's worth of birth control with one pickup. This is something that we can move. We have bipartisan interest in. We've spoken to several Republicans who are actually really excited about this. And this is something that you can come in and you can do. You can talk to them. And one, I believe you're all in Louisville, right? So, or Jefferson County. If Ken Fleming is your representative, he's very much interested in supporting birth control access. And so this is one way that you can start to talk and do things that directly impact reproductive justice. Because if somebody has more access, it reduces barriers and creates opportunities. And so there are some exciting bills that we can definitely work on. And sorry, I'm really sorry. My cat is joining the show as the Zoomies tonight. So we can definitely address some of these systemic barriers that we face. Uh, and we also have like comprehensive sex education. So Representative Lisa Wilner, if you're in Representative Lisa Wilner's district, she has House Bill 13, which is a healthy relationships bill addressing comprehensive sex education. And this is for K through 12 education. And so it addresses the lifelong needs of learning how to talk about your body, how to address issues of consent and healthy relationships. And these are things the peer ads will definitely jump into later, but this bill directly targets that. And there are Republicans who are interested in this. Representative Timoney out of Lexington is very supportive and a very conservative member of the legislature, but sees the benefits to this. Again, Representative Fleming in Louisville, also somebody we can move on this issue. So if you're in his district, definitely give him a call on House Bill 13. When we're looking on the defensive front right now, normally this is the first time in 6 years that we haven't had all the abortion bills either already heard or filed. Normally the first week of session, we're in massive defensive mode, but this year we got our first abortion bill that dropped last Wednesday. And this is something that's directly around reproductive justice. It's about abortion restrictions for minors, even with parental consent. So if you have, it's House Bill 324, it's Representative Melinda Prunty's bill. And this is making it harder for teens and minors to access abortion. It changes the waiting period. Right now in Kentucky, we have a 24-hour waiting period, but for minors, it makes it 48 hours. Both parents of the minor need to have proof of their parentage notarized. And this is also a barrier. If you don't know how to get forms notarized, if you don't have the money to get it notarized, it also brings a third party who's not necessarily trained in medical privacy to sign these forms. And it's not just the forms that you're a parent, but the forms are gonna, you also have to state that your minor is having an abortion and you're supporting it. So it's creating breaks in medical privacy. So it's a lot of shame and fear that's gonna go into this, and thinking about single parent households for whatever reason. Maybe a father is not part of the minor's life, or a mother may not be part of the minor's life, but then they're going to have to be brought in for this very personal and private decision. It really impedes on reproductive justice because it creates a barrier and it adds fear, shame, and stigma to the process. And we're not saying that parents shouldn't be part of the process. This is for parents who are trying to be part of the process and access care for their minors. But those who are not in a situation where they can bring parents in Kentucky, we already have a law that you do have to have parental consent, for one, to get an abortion, and two, you can access this through judicial bypass if you can't bring your parents in. In Kentucky, we have 3 judicial bypass lawyers in the Louisville area. So if you're in Louisville, you can, and you are able to obtain information that this is something available to you, you can get a judicial bypass, but they're now making it harder. The process for a judge to give judicial bypass has become more complicated and convoluted. So it's going to make it very challenging for any minor accessing care, no matter their reasons. And it's going to impose a lot of shame and stigma upon the minor in the process. And it's really not lost on me here. And you'll probably, once the bill starts moving, you hear this a lot, but they, in this process, they want to say that the minor is not mature enough to make this decision to have an abortion, but they are mature enough to go through a pregnancy and to be a parent. And this is lifelong. So it's really important that we have these conversations with our legislators, that bills like this are not going to stop abortion. It's not going to stop parents from trying to access abortion, but it's going to put them in the sidelines And, just think about it too. Let's say an immigrant family is here and their child is documented, but they're not. How are they going to be able to support their children if they're afraid that they're going to be deported in the process? So we're creating really onerous restrictions. So that is the one bill we are fighting right now, but we have been told that likely 11 more anti-abortion bills will be filed within the coming weeks or days. I'm actually surprised none have been filed yet, and that they will be split between 3 committees. And so this is something, I've never seen 12 bills filed, but normally we're dealing with 6, and 6 bills alone have kept us extremely busy and extremely tied to Frankfort and not working on our proactive measures. It sidelines us from bills that could actually improve so many of the statistics that go into reproductive justice and the socioeconomic, determinants of health. And so with that, I know that Taylor's going to go into a lot of it. I will drop some links into the chat on how you can support the efforts in Frankfort. We do have a lobby day coming up. It's all via Zoom. So a Zoom lobby day where we can schedule a meeting with your representatives, or you can join one that's already scheduled that may not be your representative or senator. And we will prep you on a specific topic based upon you can check what you're interested in talking about, and we will get you prepped to meet with the legislator on Valentine's Day. Or if you wanted to meet with the legislator before or after, that's something that we can always work with you on. And we are always looking for people to share their stories. Everybody has a story. Why are you interested in reproductive justice? Why are you interested in reproductive health and rights? What brought you to this meeting tonight? And it may not seem like a story, but we all have reasons for being in this movement and wanting to be better allies and advocates for our community members and the people we share community with. We are all intrinsically linked by these barriers to healthcare. And so if you have a story, we'd love to hear from you, especially too, as we're moving into what is likely a post-Roe Kentucky. The stories of what it was like before Roe are highly important too, as we are trying to break down the misinformation that gets put out there. I did want to open it up to any questions. I didn't have a lot of bills to throw at you tonight to talk about. So, and Taylor's going to break down some other pieces tonight. Oh, okay. I'm pulling up the chat. So I see from Emma, what House bill is that one? Which bill were you referring to?
I think the one that you were fighting against, and I think I've got the number. I think it's 324. Is that
yes?
correct? Yeah, that
Yeah,
last
324 is the restrictions for minors' access to abortion. And then there is House Bill 300, good one, if you want to support Representative Raymond, and House Bill 13, which is the comprehensive sex education. I'll go ahead and drop the links to volunteer in the chat. And then I know Diane had said that the Join to Protect KY .org was for legislation. It's actually for, I'll do a quick pitch. It's for the constitutional amendment. So we have a constitutional amendment that's going to be on our November ballots that will seek to ban abortion access in Kentucky. It's going to change our constitution, and it'll take away a legal pathway, any legal pathways that we have on fighting these in state. And so we're going to be doing a full frontal attack to turn out the vote against, to vote no on the constitutional amendment. We don't know what number it's going to be yet. But Join to Protect KY.org is where you can sign up, and I'll drop the link in the chat as well. We have another sign up that you can fill out. That website, I'm not sure, we just changed consultant firms. So I'll drop another link in the chat because I'm not sure if there's somebody checking that at the moment, so that you can stay with us, because it's going to be we're going to need all hands on decks for that fight ahead. And I know that you have, I believe I saw Stephanie Compton in here too, and she's on the committee for the Protect Kentucky Access campaign on that.
I think Wayne Ganatic is on it too, isn't he?
Yes.
And
Yes.
he's on.
Oh, wait, hold on. I can't see the full screen. So,
Okay.
I was blacked out anyway, but
Sorry about that, Wayne. So we will hear more about Join to Protect KY.
I'm going to drop a different link in the chat because the name, we have a new consultant firm and all that's changing. So I'll drop it
Okay.
in the chat real fast. I'll go ahead and copy those and then turn it over to Taylor unless there's any questions around upcoming legislation or how to participate in the advocacy front with me.
I had a question. You said it was going to be all hands on deck. Is that just in case, or is there really a strong feeling that it would pass?
So the constitutional amendment passed last year. So it is on the ballot. Like that is for sure. We are going to have abortion on the ballot this November. And so we are going to have to do organizing across the state and education so that people know to vote no on the constitutional amendment to ban abortion. And more information, the campaign will be doing a lot. It'll be very visible very soon. But I think if you're looking for something in the summer and fall electorally to put your time and effort into, this is an all hands on deck moment that we're going to need to come together. And one of the things that's so hard for me to get, and not just me, but all of my partners, are phone bankers, are people to knock doors. And this is something that we are really, we need. We are already phone banking. Planned Parenthood's already doing phone banking on the constitutional amendment to raise awareness. You can join now and do that. And you can, but also I think start looking at your summer and fall and make sure that you are scheduling time to support this because it is on the ballot.
Yeah, no, I understood it was on the ballot. I just was wondering if there was a sense that the vote wasn't going to go well, or do we? I mean,
so the last polling we did, we're just about to go back in the field on polling, was in 2019, and polling showed that 65% of Kentuckians supported access to abortion, that they did not approve of all the bans. Now, that also cut across those who identified as pro-life and Republican and religiously affiliated, but they didn't like that it was being made inaccessible. All of these bills that we're seeing pass now have no exemptions for rape, for incest, for fetal anomaly, and very few exemptions for life of the mother. And that's something that most people can agree on, whether, I think abortion should be accessible for everybody, but most people who are, identify as pro-life see exemptions being needed. And we're not none of the bills that have passed in the last 3 years have exemptions. So that's where that polling came from. And so we know that there is a lot of room for us to win on this ballot because they've gone so far that there are no exemptions. And the ballot measure makes no exemptions for rape, incest, fetal anomaly, and there are no exemptions for life of the mother. So we have an opportunity. We'll have more polling within, I think, the next 2 months too. We're just about to go back in the field, so I can send information on that when that is made public. But I feel very hopeful. I know from the work that I do across the state that there is a lot of common ground, and for people who are uncomfortable with abortion, they also know somebody who's had complications in pregnancy. They know somebody who's had an abortion, and the bans have gone too far. So there is a lot of promise that we can win this if we mobilize.
okay, well, that's good to hear.
Yes, that's getting me through. And as when I think about my job, there's a lot of frustrating pieces about it. I know that there's a supermajority in Frankfort. There's not a whole lot I can do when a bill moves. And so even with this promise of 12 anti-abortion bills this year, I keep going back to we can win at the ballot, and we can show that abortion 1 can win in Kentucky, which will transform the way I think that politics and abortion is talked about moving forward when we win at the ballot. And that gives me a lot of hope for our future and the way that campaigns and politicians are responsive to us and this issue. And it gives me hope. Right. And so I have the Valentine's Day lobby link is in the chat. And then the Protect Kentucky Access sign up to is also in the chat. Any other questions?
Now we're copying down.
I will have all the resources mentioned tonight, just like subsequent sessions, in the caption underneath the YouTube video, and it'll be sent out as a PDF with your links. If you're in the St. Andrews church email list as well.
Oh, and you all are gonna be mad at me. I put in, so if St. Andrews wants to sign up as a sponsor of the Protect Kentucky Access, that's the form I put in. This next one, I'm sorry, we have them all labeled very similarly in our document here. So that this next link is the correct one to volunteer. There we go. So the sign up and the lobby form is what you can hit. I wonder if I can delete. Other than that, I can turn it over to Taylor and her fabulous peer educators.
Here I go, to start right off talking mute on. Hi, everyone. So nice to be here with you tonight. Thank you for having us. Thanks to Tamara for kind of walking through all the stuff that's going on in Frankfort. Yeah, and I don't, yeah, it's good. I feel a little better actually hearing you talk to Mari, a little more hopeful as you kind of talked about the amendment that way. But anyways, so I'm Taylor Ewing. I am the community education lead at Planned Parenthood here in Louisville. My pronouns are she, hers. And yeah, I facilitate our teen council group, which is our peer education group. That's mostly who is going to be leading our lesson here today. We're going to talk to you a little bit about reproductive justice, of course. These are some lessons that our peer educators, our teen council members, we do in our weekly meetings. We'll talk about a bit. And then we have facilitated this lesson. We did it a lot last year and we're really excited to do it here for you. So yeah, you'll learn a little bit about their program, and then they will help you kind of deep dive into this topic of reproductive justice. So I think, let's see, I'm gonna hand it over to you, Lexi. Actually, before we talk about this, I'm gonna have everyone introduce themselves. So if y'all wouldn't mind, if you're not yet, and just going through and sharing with everyone your name, school, grade, and Cameron, would you want to start for, oh, Lexi, you can start, and then Cameron, you can go.
Okay. Hi, my name's Lexi. I'm an intern with Planned Parenthood. I help with stuff in education, and I just started helping with policy too. So I work with Taylor and Tamari. I use she, her pronouns. I'm a sophomore at U of L. I graduated from Yale in 2020. I really like reproductive justice. It's one of my favorite lessons. Taylor and I have been doing, and Kindia have all been doing a lot of work on it for a little over a year now. So yeah, super excited.
Hello, my name is Cameron Morgan. I'm a senior at Brown School. I use she, her pronouns.
Hi, my name's Mia. I'm a sophomore at Collegiate, and I use she, her pronouns.
Hello, my name is Kindia Motley. I'm she, her pronouns. I'm a senior at Jeffersonville High School. I have been with the program for about 2 years now. It's been one of the most funnest years of my life. Hopefully that's the word, but I just wanted to make it clear how much fun I'm having with the program. So.
Thank you. Thanks, y'all. Okay, so I think now Lexi's going to start us off and talk a little bit about what teen council is.
Yeah, so the Teen Council mission is to empower, educate, and inspire those we know, including our peers, families, and communities. Teen Council educates about human sexuality and healthy decision-making. We use our voices to advocate for just and humane sexual attitudes and policies. I joined Teen Council when I was a senior in high school and then have been interning while I've been in college. And it's a really great way to like get to know people interested in social justice around Louisville. If you know anyone in high school, sophomore through seniors can apply to be a part of the program. And if you're lucky and you're really cool, you can work with Taylor even longer in college. So definitely recommend.
Hello, and just to give you a quick background on what our meetings and lessons are like, my fellow peers and I come together to fill the peer education program to learn and receive education about different topics such as gender equality, sexual orientation, sexuality, bodily autonomy, what we're discussing today, reproductive justice. And with learning that information, we go out in our community to educate on these human experience topics that are not but should be commonly discussed. And just to give some education as to why I'm a peer educator, I wanted to learn, and I'm glad I can learn these important tools that people are not casually taught about our health and bodies. To be able to learn is miraculous, but for me to be able to learn, to teach, and spread the knowledge I'm gaining is a blessing.
With presentation, that's the core of Teen Council. So we really visit and teach lessons to schools or events like this online, and mainly we've been doing it online, but recently one of my first help facilitating with Ms. Taylor was at Manual.
And we also have informal education. So if some of our peers, like our friends, fellow like teenagers, have questions that Planned Parenthood would be able to answer, then they can come to us if they're too afraid or too embarrassed to go to an adult. It's just like a more casual way of them getting accurate information, and it a lot of times like causes people to feel more safe. And I've like experienced a lot of people coming to me for informal like education. I get a lot of questions about how like effective certain types of birth control are, or like which type of birth control is best for which person. And I get a lot of questions about like the spread of STIs and how to prevent that. And so those are topics that like I really wish a lot of teens knew more about. And so I really like helping out other teenagers and like educating them about that.
And for advocacy, we get to work with a lot of really cool local representatives like Representative Wilner and Representative Scott. And Teen Council will help like lobby when like before COVID would have like a rally day and go. The picture on this PowerPoint is from a rally we had earlier or like last year in the fall. So we get to do a lot of cool things around Louisville and get engaged with the community a lot more through like advocacy.
Awesome. And I just want to say, y'all are welcome to ask us questions throughout. So if you have any questions about Teen Council, about the program, we'd be happy to answer them now. If you want to get right into our topic of reproductive justice, y'all can ask more later. But if you have any at the top of your mind now about what our program does, we'd be happy to answer them before we move on to the activities. Okay, and it's cool if you don't. Feel free to stop me, put them in the chat, say them out loud, any of that good stuff. So I do want to give everyone a heads up. We always like to do like content warning. Sometimes you may have heard it called trigger warning. When we are going to be teaching about different topics that may bring up tough issues, to give folks a heads up. So just our kind of content warning here for y'all that some of this content can be intentional, emotional, or triggering, as we will be discussing systems of oppression like racism and sexism. So ask you, take care of yourselves, do what you need to do. Certainly let us know if there's a way that we can support. And then the last thing before we sort of dive into this topic is another thing we always do for our lessons is we like to establish group agreements. So we'll do this here with you today to kind of show you how we keep our discussions, whether they're in a classroom or within our meetings, as safe and comfortable as they can be for everyone. And then also so we can make sure our conversation here today is. So I think it's Alexi to kick us off talking about don't yuck.
I
Yeah,
love that agreement.
yeah. So the first agreement, don't yuck my yum, just means sort of what it says. Just don't immediately like bash on or be mean about what is important to someone else. Like don't yuck somebody else's yum. Yeah.
And another one is take space, make space. If you are the type of person like me, for example, who's very passionate and just has so many things to pour out of her heart, which is beautiful. But if you're the type of person that talks a lot, with that being said, and you notice yourself kind of dominating the conversation, just take a step back, see if someone else wants to speak. And if you're more on the quiet side in group, speak up. We'd love to hear you.
The next group agreement, what's said here stays here, what's learned here leaves here. So that really means not to spread personal information or personal stories, but to spread the learned information with others who don't know.
And the final group agreement that we have is honor intent, but be accountable for impact. So if someone has good intentions, but accidentally says something that might be like offensive or hurt someone, to honor their intent, know that they had good intentions. So don't get mad at them when they had good intentions, but that person should still be accountable for the impact that they had and apologize. So like a smaller example would be like, sort of if someone like steps on your foot, they might have had good intentions, but they still hurt you. So you should apologize for that. And it goes, the same thing applies for when accidentally saying something that might be offensive or hurtful.
Awesome. Thanks y'all for explaining those so well. Anyone have any like questions about the group agreement? Lovely. Okay. And then Mia, do you want to talk real quick about our video?
Yeah, so our next video kind of has to go with the honor and intent, but be accountable for impact. And it has to do with like how certain people might face certain struggles, and you should like respect that and be like supportive. And this video really stuck with me. So yeah.
Yeah, this is one of our favorites. And so we thought y'all would enjoy it. So yeah, I will. Somebody holler if you can't hear the sound.
In the garden, there's a caterpillar and a snail, and they're basically best friends. They hang out 24/7. They do dinner, movie nights, crafts. Oh, and they're like really into cosplay on top of like whatever else caterpillars and snails do, like eat leaves or something. Anyways, one day they're on their way to a party that's right outside the garden, and they have to go through the fence to get there. So the caterpillar goes right through, but the snail is stuck. Her shell is just too big and it won't fit under the wire. So she's like, crap, I can't get through. Maybe like, can you lift up the wire, or maybe we can build a little bridge or something? And the caterpillar's like, dude, just go under. But she can't. There's just no way that the shell is gonna fit. And the caterpillar's like, go under, come on, we're gonna be late and I'm trying to hook up with that super cute ladybug. But it's not happening. The shell will not fit under the wire. And at this point, Snail's getting kind of frustrated because it's not like she doesn't want to go to the party, but for some reason, Caterpillar just isn't getting it. Yeah, it's not that easy for me. I just can't crawl under the fence like you can, so I would really appreciate your help here. Maybe we can like go a different way, and this just like sets the caterpillar off. What the heck? Just because I can crawl under stuff doesn't mean that I have it easy. Do you even know what it's like to have 16 feet? You don't, because finding shoes is a complete nightmare. Whoa, whoa, whoa. I'm not saying you have it easy. I'm just saying I can't go under the fence because of my shell. That's it. I have a shell and you don't. And there's some stuff that's easier for you that's harder for me. Just like I don't know jack about finding shoes because I don't have feet. Caterpillar thinks about this for a second and realizes the snail is right. I mean, he's never had to think about shells or slimy trails, and that's a privilege that the snail has never had because she has to think about that stuff all the time. That's part of being a snail. And it's kind of like that for everyone, right? I mean, we all have our own struggles and challenges, and some of them are small and some of them are huge and really unfair and beyond our control. And a lot of the time, it can be hard to see what someone else deals with because you've never been in their shoes or shell. Like maybe you're gay or trans, have a disability or different religion, or of course the obvious one, you're a member of a different race. I don't know what it's like to be you, and you don't know what it's like to be me. So it's really important to stop and try and see the other side so we can help each other overcome those obstacles together. It's like sometimes you're the snail and sometimes you're the caterpillar. Oh yeah, okay, so then the snail and the caterpillar figured out that if they went to the other side of the garden, they could get through a little break in the fence. And while it took a little longer to get to the party, they did the trip together, which is what made it so great. So they got to the party, the caterpillar hooked up with the ladybug, snail taught everyone how to do the wobble, and the party was everything. The end. This video was illustrated by the very talented and lovely Kat Black and written and narrated by yours truly, Cheska Lee.
All right. So, anybody have any thoughts, reactions to our video there? We think it really sort of is a really fun, accessible way to sort of show our approach to how we want to talk about these things, which is to come in at that good understanding, right? Those open minds, not being offensive, all those sorts of things. So it's one of our favorites. So glad to have the opportunity to share it with y'all. Okay, so I know that y'all have been talking about reproductive justice and kind of recapped it at the beginning. So I'm curious if someone wants to say out loud or put in the chat, like, what's been sticking out to you from this conversation about what reproductive justice is, maybe how your thoughts have changed on it as you've gone through the last couple of sessions. And I know not everyone's been at all the sessions, but if anyone wants to share, what's sticking out to you about reproductive justice?
So I think for me, what I have found helpful is what has prompted me to think is, and I kind of knew this a little bit going in, but I didn't fully appreciate it, and that is how multidimensional it is. How much, you see the phrase reproductive justice and you kind of almost automatically translate, oh, it's about abortion. Or you think maybe, oh, it's about pregnancy, that sort of thing. And it's so much, those are like they're not unimportant, but they're just the initial layers of these issues. And there's so many economic, social, ethnic, health, policy, political kinds of issues all beneath it. It really, once you begin to grasp the initial piece of it, it all just kind of fades out in a lot of different ways, like a spider almost.
Yeah, I love that. I love so many of you pointed out there. And one of the first things you said that I think is really important is we kind of know that, but we've just had this kind of laser vision. And so it's not like any of it is, brand new, but we just haven't had the opportunity or maybe the context or life experience to really kind of open that up. And so that's so much what it's about. So thank you so much for sharing. I feel like you really captured, the journey that a lot of folks are on with this topic. And then I see a few folks in the chat kind of think the same. So anyone else want to add anything there?
I think one of the things, somebody said it earlier, but probably one of the most important things for me is that learning to talk about it.
Yeah.
I mean, it's not something that just comes up in conversation all the time. And lots of times people are almost, scared of it. It's one of those things that everybody dances around, but learning the language, one, and two, learning just to be able to be comfortable talking about it.
Yeah.
What it is to you, what it is, personally to you, and what it is as far as way more than abortion, right? I mean, everybody zeroes right in on that, and has been said several times. So just being comfortable talking about it and being here to be able to talk about it in a safe space kind of helps you then kind of branch out a little bit and talk about it in an area that maybe isn't quite as safe, but
Yeah.
it adds a little bit more of a comfort level.
I love that. Thank you so much. That's beautiful. And I just kind of had this moment. It's very cool here being with y'all because it's really similar to what I tell my peer educators and my teens. They are so important. They're so powerful because they're the ones that make these issues, just when we're talking about healthy relationships or consent or, safer sex, like they normalize it for their peers. Like those conversations that they have are so powerful because they're talking to each other, they're normalizing for each other. And it's really the same thing for y'all. Like the conversations that you are having with your peers, your network are super powerful. Like you're going to be able to reach folks in a way that we never could. And so, yeah, just like taking that step, it can be really hard and nerve-wracking to talk about these systems of oppression, but challenging ourselves, learning, making mistakes sometimes, saying we're sorry when we're doing, moving forward, is I think what makes that real difference. All those things Tamara was talking about at the beginning, right? To make a real difference in the laws, the rights we have, people's attitudes, all that stuff, as we heard before, it just kind of all is that spider, right, that branches out. So thanks y'all so much. I really appreciate your thought there. Do any of my team council members want to add anything or say anything here to, on these thoughts? You don't have to, just if anyone had anything I want to say to reflect.
I'm not understanding you all, Taylor. I don't know why, but a young lady died in my arms in the late 60s because she had tried to abort with a coat hanger, and we found her as we entered a project that we were volunteering at on a Saturday morning, a group of church folk. And so I've always known the horrors of attempting abortions, but I've always stayed away from conversations because I don't have the language and the vocabulary to talk with people that are so resolute about pro-life. And so what I need to do, I know, is to build my bank of stories and situations. And each week of this program, I have gained more resource for myself to talk about reproductive justice. And tonight it was simply you're mentioning the immigrant family. They're here, there's a teenage daughter, she's trying to make friends, she's taken advantage of, she gets pregnant, and she cannot terminate that pregnancy because her parents are undocumented.
Yeah.
That's a horror story. And people need to hear that over and over again, that these are some of the people who are being affected by the legislation that is being proposed. So the more stories I hear from people like you and your teen educators and all the Planned Parenthood counselors of situations where terminating an unwanted pregnancy is so important to the well-being of the family and the well-being of all members of that family, just to help us get a reserve of language to talk about people that are so resolute on the other side. Because I do believe minds can be changed.
Yes.
As you indicated earlier.
Yeah, thank you so much for sharing that story. I mean, it's just so powerful. And, as Tamari sort of said earlier, that, that's pre-Roe is pre my life, way pre my teen lives, obviously. And they have, so many stories and insights, to share and to bring. And you do too, because those are stories that we don't know. And it's just really cool, like these opportunities like this to bring in folks with such, different experiences and from different times and places and to share those. And so, thank you for sharing that and pointing it out. And we are going to get into a lot of history that will really like branch up and connect, I think. So
Yeah, and I just
Tamari, do you
want
want to say something? Yeah.
Yeah, I just want to say too, I did pop in a link to share your story. You don't have to have a fully thought out story, but we work with you on the language, on helping you empower you on how you share your story. So I did put that link in there because really sharing those stories are what moves the needle and is what is going to be so needed in not only this legislative session, but the upcoming fights ahead, especially with the ballot. So there is a link in the chat to sign up.
In my personal 2 cents, and I certainly don't have it figured out. I've got my own problems in my own life with my own family and friends and all that with those conversations, as you say. Some people are resolute and it can be not worth our energy, I think, trying to persuade. And sometimes I think it's about not letting certain things being said be normal or be okay, right? So maybe we're not going to convince them, but you can also, not be a safe place for certain language. And then sometimes it is connecting on those other topics that bring you together to where then you can go to the next one. So I wish I had the great answers for overcoming that. I haven't got there yet, but just trying and just caring too, I think, is ultimately the most important. And taking care of yourself in the meantime, because it can sure, get your head spinning. So, all right, I have a quick video just to kind of sum up reproductive justice that we think is helpful, and then we will go on to our topic. Sure, on time here. So this one's pretty quick, but it's one of our favorites to just sort of introduce and sum up this definition.
If you think about the combining of reproductive health and rights with social justice, you develop a construct called reproductive justice.
Reproductive justice started as a framework, as a movement, right?
But in 1994, several Black women really actually coined the term.
And it really started off thinking about sex associated with reproduction, right? Produces a pregnancy. And so what are the rights of that person?
It is a human rights-based theory and praxis that posits four very important things. People have the right to create family and to create kin in the ways that they see fit.
What are the options available to you if you choose to pregnant and to birth, right? Birthing shouldn't really be totally in the hands of OBGYNs. And I say that as an OBGYN, right? So how do you think about the birth workforce and the birth support team?
They have a right to prevent and or end pregnancy if that's something that they need to do for themselves and their families.
What to do if you want to end the pregnancy, and how do you do that with dignity and safety and respect?
They have a right to parent with dignity without manipulation, coercion, or violence from any individual or from the state.
People who currently have children, what are the supports and services and accommodations that the community and the government are accountable to our community to ensure that people can continue to parent their children the way they want to in the family composition that they choose?
And they have a right to disassociate sex from reproduction, which I think is really important because then that affords us opportunities to have discussions around consent, healthy sexuality, pleasure.
And RJ opens all of that up so that we really think about options and power and autonomy and not control, constraint, or coercion.
If you think about the combining.
Sorry, my videos always like to start over. Yes, so I think you all captured this. You've been talking a lot, and I think they sum it up really brilliantly. We often hear that said: reproductive justice is the right to parent, the right to have children, not to have children, and the parent to children that you have, right, without fear. for their safety, for their health. And so, but one of the most powerful lessons that we do and discussions that we have is actually going through US history and looking at different examples of reproductive oppression as well as reproductive justice throughout that history. So the story that you shared, you know, about someone dying, you know, from a botched abortion is obviously horrifically, you know, tragic. And there's so many tragic stories around our intimate relationships, our family, our sexuality, you know, that have to do with abortion, that have to do with, you know, parenting, with our sexual orientation. And so this is just kind of pulling those together and just saying, you know, without one, right, we won't have freedom in any of them. That all of these freedoms are connected. And so that is what this activity is about. So I'll just give our heads up again that this is the part where we will bring up some, you know, pretty heavy emotional or triggering history. So just a heads up about that. And we'll be framing this looking at what we call like strategies for reproductive oppression. So different ways that this oppression has been achieved or has been implemented throughout our history. So that sounds like too blah, blah, blah. Don't worry, it will make sense as we get into it. All right, anybody questions? Anybody folks want to add anything before we move on to our timeline? All right. Okay, so I think Cameron and Mia are just going to introduce this topic of reproductive oppression to us.
Reproductive oppression. Historically and today, many communities have been prohibited from expressing full reproductive freedom. This is called reproductive oppression.
Reproductive oppression refers to unequal outcomes and reproductive health and wellness that marginalized communities experience.
Reproductive oppression is upheld by institutionalized strategies rooted in systems of oppression, such as racism, sexism, homophobia, classism, ableism, faithism, and more.
Great, thanks, Jules. All right, Lexi, you are up first.
Yeah, to get into the strategies of reproductive oppression, we're going to start with economic marginalization, which is groups of people are restricted from participating in and benefiting from mainstream economic activities such as bank loans, family tax credits, or welfare benefits. In addition, economic benefits and support are withheld. For an example, in 1977, the Hyde Amendment made it illegal for federal Medicaid to pay for abortions, except in the case of life endangerment for the pregnant person. It marked a failure of the mainstream choice movement to stand with communities and women of color to ensure that abortion be accessible to everybody. And then in 1996, the Personal Responsibility and Work Opportunity Reconciliation Act punished low-income people on welfare for bearing children and coerced low-income people to marry. And finally, in 2014, officials in Flint, Michigan failed to properly treat water, causing lead from aging pipes to leak into the water supply. This resulted in dangerously high levels of heavy metal neurotoxins in the water. To date, between 6,000 and 12,000 children have been exposed to drinking water with high levels of lead and experience a range of serious health issues.
Now we have political subordination. Groups of people do not have power to decide for themselves and are not allowed to be a part of the process for making the policies that directly impact the reproductive lives. In 1873, the Comstock Law restricted any individual from selling or sending obscenities. This included automation of contraception and abortion. The punishment for violating the law was imprisonment for no less than 6 months and no more than 5 years, or a fine of not less than $100 and not more than $2,000. This law would not be overturned in the 1965 case of Griswold versus Connecticut. In 2003, parental notification of consent laws.
I'm so sorry to interrupt you. You're a little warbly. I don't know if you can maybe get closer to your microphone. We may have lost Kenya, so I'm going to read these and Kenya will hop back on. Okay, So in 2003, parental notification or consent laws were passed around the country, restricting abortion access for minors under the age of 18. In 2014, in the case versus Burwell versus Hobby Lobby, the United States Supreme Court held that Religious Freedom Restoration Act of 1993 permits for-profit corporations that are owned by a family or family trust to refuse on religious grounds to pay for legally mandated coverage of certain contraceptive drugs and devices in their employees' health insurance plans.
Assimilation, the reproductive knowledge and attitudes and behaviors of groups of people are demonized and portrayed through cultural reference as an uncultured and inhumane or immoral. Native Americans were trafficked to boarding schools to assimilate. Students were tortured and even killed for speaking indigenous language or practicing their religion and culture. Since the U.S. assumed the governance of Puerto Rico in 1898, population control has been a major effort. In 1937, the U.S. imposed a law 116 onto Puerto Rico, a law that legalized sterilization on the island under the belief that Puerto Rico was too overpopulated to have a stable economic, and the only way to lower unemployment rates was to decrease the population density. A campaign carried out by a private agency and the U.S. government since the 1940s resulted in sterilization of 1/3 of Puerto Rican women. In 1980, Phoenix, Oklahoma City Indian Health Service used Depo-Purella on Native American people with the uterus with disabilities despite the fact that it wasn't approved by the FDA. The reason was given for hygienic purposes or to stop periods of patients with the development of disability. In 1990, Depo was given to people of color with uterus in public health clinics, often without adequate medical information or consent.
So the next strategy of reproductive oppression is the regulation of families, which is the ability of certain groups of people to form, make decisions about, and support their families are restricted and or controlled by other agencies. An example of this happened in 1875 when the United States Congress passed the Page Act, which effectively ended and the entry of unmarried East Asian women into the country, as well as a way of limiting family development. This act was followed by the Chinese Exclusion Act in 1882, which banned all people from Asia. Another example of this happened in 1913. In the United States, various state laws prohibited the marriage of Black and white people, and in many states, also Asians. These laws were called anti-miscegenation laws. Between 1913 and 1948, 30 of the then 48 states enforced such laws. Another example of this was in 2018. President Trump's inhumane zero-tolerance immigration policy continued the legacy of U.S. deportation and xenophobia. ICE began to heavily target and harass immigrant communities, engage in acts of family separation, as well as subject those targeted to inhumane conditions at detention centers. As the COVID-19 pandemic developed, detention centers were neglected and or subjected to harmful chemicals and lack of healthcare resources. This legacy continues as Haitian immigrants are targeted by ICE under President Joe Biden.
Perpetration and or threat of violence. Harm or threat of harm is inflicted upon certain groups of people just because of who they are. The harm can involve physical, sexual, psychological, or spiritual violence. In 1846, the so-called father of modern gynecology, Dr. James Marion Sims, purchased and used enslaved African women as research subjects without their consent. He is known to have performed excruciatingly painful procedures on at least 4 enslaved women. Records show enslaved women Lucy, Betsy, and Anarcha endured more than 30 surgical procedures without anesthesia. In 1917 through 1923, over a period of 7 years, white mobs attacked Black communities in Illinois, Washington, D.C., Florida, and Oklahoma. The Tulsa Massacre took place on May 31st and June 1st, 1921. Mobs of white residents, deputized and given weapons by city officials, attacked Black residents and businesses of the Greenwood District and Tulsa, Oklahoma. It has been called the single worst incident of racial violence in American history. 2020, in a span of only 9 days, June 25th to July 3rd, 6 Black trans women ranging in age from 17 to 32 were murdered. Their names were Brayla Stone, Mercy Mack, Shaki Peters, and Drea McCarty, Tatiana Hall, and Bree Black. In 2020, the Human Rights Campaign tracked a total of 44 violent fatal incidents against transgender and gender nonconforming people in the United States, making this the most violent year on record since Human Rights Campaign began tracking these crimes in 2013.
I'm back. Control of bodies, gender, and sexuality. Certain groups of people are prevented from determining and expressing their own bodies, gender identities, sexual preferences. In 1973, the American Psychiatric Association removed homosexuality from its list of mental illnesses. That same year, it added ego-dystonic homosexuality, which many consider to be simply a new name housing the same prejudice. Finally, in 1986, the diagnosis was removed entirely. In 1980, gender identity disorder was added to the list. In 1996, Congress passed and President Clinton signed the Defense of Marriage Act, banning marriage between same-sex couples. In 2021, according to data from the Human Rights Campaign, at least 117 bills have been introduced in the current legislative session that targeted the transgender community. This includes bathroom/locker room bans, youth sports bans, as well as bans or restrictions on gender-affirming medical care, such as puberty blockers. Okay, we know that was a lot, so we can all take a deep breath together and kind of debrief a little bit. If somebody could speak, if you guys don't mind typing in the chat or saying out loud, what are your initial thoughts/reflections from the timeline, anything on it, or your feelings? If you have feelings you want to talk about or some thoughts you had about something said, any additional thoughts at all?
And we can definitely take our time, as Kendi has said, to stop, breathe, process, because we know it's a lot. So please take your time.
I think my initial impression is just how overwhelming it is, you know, and how again, just like reproductive justice is multifaceted, so is the oppression. And so it seems, yeah, it seems a lot. It seems for a long time, you know, that this has been an issue that has created so much contention amongst people and so much misunderstanding and so much, yeah, like it's life and death. And so I think the seriousness of it is really apparent when you read through that timeline.
Absolutely. Thank you for that. It is overwhelming, especially when we realize those were only a few listed. You know, there's so much more. Thank you for your words, for sure. David Carlson said these issues are not new. There's not a lot of comfort in that, but it does show the problems are not new. Exactly.
It does.
Yeah,
Right.
I mean, my comments are kind of the same in that when you look back at the history, and the history many times, and in fact, most of the times, state sanctioned discrimination of some sort. And a lot of these things, even though they happened quite a while ago, are just now really being addressed. But it makes me wonder what's happening today and what are we maybe even doing unconsciously today that 50, 100 years from now, they're going to look back and say, I can't believe they did that, so it makes you really think about, maybe we need to step back and really think about the things that we're doing today and how are those affecting, people in the future.
It really makes me nervous when I look at the history of that and think like the Hyde Amendment is still in play. I mean, it is still there. The fact that, Hobby Lobby can not have to provide birth control, medical care to their staff because of their religious beliefs. I worry that we're moving backwards, that we're going to get more repressive rather than more liberal about these things. So.
Absolutely. Thank you for your words. Oh, no, please.
I feel like this would be a great presentation for the legislators. I am sure there is a committee where this can be presented there. I worked in Frankfurt for 24 years for the Legislative Research Commission, and I think they have no idea that this has been going on for this many years. And they don't, they're not aware. They're looking at today and they're making decisions on what they think. But this is bigger than just them. This is so much bigger.
Kenya, can I add?
Absolutely.
Can I add to that?
Absolutely.
I couldn't agree with you guys more. When we were learning about RJ, we had a timeline, like the whole timeline, not just certain parts that laid out. And with the papers that were printed out, it was white papers for like one step back and pink papers for like one step forward. And reading that, it was a lot to take in. And as I slowly went closer to current time, we start to see a full strip of pink papers, and that just made me feel so much better. Finally taking just like one step forward, and even though it was like pink and white and then pink, white, having that one step forward and then two steps back, at least we become so far from now. It's just that we have so far to go, just kind of having that mindset.
Absolutely. Thank you, Cameron. And thank you for everything everybody said. Does anybody else have any more thoughts about it? Even if you want to type it in the chat. If you have any more thoughts. Oh, sure.
Okay, you're good. I also just want to say that like the peer educators like working on this right now, like like helping teach you all and stuff right now, if there is something to be optimistic about, I do think it is them, because like, they sit and talk to Taylor and I about these issues all the time. And I've been very fortunate to work in a lot of youth programming, and like young people know what's up. Like I really have faith. There's a lot to be upset about, but there's also a lot to be optimistic about too.
Agree, for sure. And if you have any more thoughts, please feel free to say them out loud, out of nowhere, or type them in the chat. We'd love to hear you. But just to add a question to this conversation, what are some ways you see reproductive oppression occurring in your community, and what strategies are at play? Do you guys feel?
And actually, Kenya, I kind of have pulled up the slide too. So if folks have other thoughts, please answer Kenya's question. But then I think we can also segue that into the question of Breonna Taylor, which is a very, immediate issue to all of us here in Louisville. How is Breonna Taylor's death a reproductive justice issue? So feel free to answer Kenya's questions about things you see, or if you want to connect to Breonna Taylor.
One of the things that bothers me about the Breonna Taylor case is how the media cannot bring up Breonna's name without bringing up the former boyfriend, as if her identity is tied to his. He was arrested last week, and the story wasn't just that whatever his name is was arrested on charges, but this man, Breonna Taylor's former boyfriend, and so it removes all dignity from her when she is constantly associated with someone whose behavior is being under arrest. It just bothers me when women are treated that way. And we see it frequently where a woman is held responsible for the activities of a former boyfriend or a former husband or whatever. You know.
I don't think that's just a gender thing though, Diane. I think I think it goes both ways, and I think it's just, you know, people aren't looked at as an individual. You're looked at as a person who's associated with somebody else, fairly or unfairly. So I agree with you that I think I cringe every time that happens. That you can't bring up one without kind of like saying, well, it's almost, and please don't take this wrong, but it's almost as if the media is saying in some way, well, because she made a bad choice in her previous boyfriend, that's what got her into this situation. And that's just horrible. It makes me cringe, you know, but that seems to be the insinuation in so many ways. And I think it's very unfair. And I think it's very, I don't know. It just really burns me up.
Misogynistic.
I can't express it without saying
it's misogynistic.
Without saying words that I don't want to say. So
it's misogynistic and it's racist both.
Right.
And I think,
Right.
you know, we can see this happening to anyone, as you say, David, but there's a reason we see it happening to women more. And there's a reason we see it happening to Black women more than white women. And we saw that throughout the history, right? Anyone in this country, you know, can be a target of, you know, violence, abuse, harassment, prejudice. But overwhelmingly, we see this impacting marginalized groups. And of course, you know, you're familiar with that term intersectionality. When we have marginalized multiple marginalized identities, we are going to see that target and that oppression multiplied. So for a Black woman like Breonna Taylor, right, her risk and then her treatment, right, has been multiplied, right, by what a white cisgender man would experience. That doesn't mean he wouldn't, but it means that we see it elevated to many degrees. And I think, Diane, you know, also the point that you made, you know, about it's really dehumanizing Breonna Taylor to excuse what happened to her. And you can very easily see those connections for hundreds of years when we look at that history. And then this is, you know, in our community here, in such a current time frame. And so I know we're getting close to the end of our time. I just, you know, so value y'all's thoughts and conversations. You know, lots of reasons we can connect Breonna Taylor to reproductive justice. Her mother's, right, ability to see her daughter grow up, you know, for Breonna Taylor's ability to have that life in the family that she wanted.
Right.
You know, obviously abortion is such a powerful and important issue, but for us to have our families, for them to be safe, free from violence, you know, just the terror and trauma of her family for generations, right? And of our community is reproductive justice. Sorry, whoever was going to speak, please go ahead.
No, I was just going to say you basically, Taylor, you said what I was going to say. So as far as, you know, the misogyny and that women are always going to, and women of color even more, or women of in minorities or in immigration or whatever, they're always being the ones that receive the short end of the stick, so to speak. And so I just wanted to commend you all for this presentation and the, as far as, I know several people have said about getting the language and getting knowledge, and this has been really great because it gives me, like we said, it's more than just abortion, and to have some of that ammunition and that language to think about this. And for me, thinking like, I don't have stories like Diane has, but I was a high school senior when Roe v. Wade when Roe v. Wade happened. And so, to see where we are and to feel such frustration and looking back through that history to say that we haven't, I feel like we haven't come that far, but I'm happy that, is it your other colleague, that she said, Lexi said that she's hopeful because of the youth. So what I want, if there's anything that all of us old people need to do to help you young people with all of this, that's what I want to be able to do to help you all. Because I do have a lot of faith in you all too. I have 2 granddaughters, teenage granddaughters. So
Yeah, that's awesome. That's so appreciated. And I want to leave us all. Oh, you all see my Zoom bomber here, my 3-year-old. But I want to leave us. There's a lot of repression, but there's a lot of acts of justice and power in our history as well. So I know we're getting close to time, so I want to make sure we can highlight some of these as we sort of wrap it up. So I'm going to hand it over to my crew here to read you all just through a abbreviated list of some examples of reproductive justice in our history.
Okay, so in 1851, Sojourner Truth delivered the famous Ain't I a Woman speech at the Women's Rights Conference in Akron, Ohio. In this speech, she described the discrimination she experienced as a Black woman due to both her race and gender.
In 1940, the U.S. Public Health Service strongly recommended teaching sexuality education in public schools, labeling it as an urgent need.
President Johnson signed Medicare, a health insurance program for elderly Americans, and Medicare, a health insurance for certain low-income people, into law.
In 1967, the United States Supreme Court unanimously ruled the Loving v. Virginia that anti-miscegenation laws or laws prohibiting interracial marriage are unconstitutional. With this ruling, such laws were no longer in effect in remaining 17 states that they were still enforced.
In 1977, the Combahee River Collective statement was written by Black feminists actively committed to challenging racist, sexist, heterosexist, and class oppression. It is a key document in the history of contemporary Black feminist thought and highlights how neither the feminist, gay liberation, or civil rights movement addresses the needs of Black women, including lesbians, working class, and poor women.
In 1997, Sisters song Women of Color Reproductive Justice reforms to educate women of color and policymakers on reproductive and sexual health and rights, and to increase access of health services, information, and resources that are culturally and linguistically appropriate.
In 2003, several courts ruled favorably on claims by transgender people in prison to be entitled to hormone therapy.
In 2006, Tarana Burke, a Black activist from the Bronx, began using Me Too to acknowledge and build community with women who are survivors of gender-based violence and sexual assault. The simple phrase began a global movement for survivors' empowerment. Burke says what is now called the Me Too movement was to spread a message to survivors. You're heard and you're understood.
In 2013, emergency contraception, also known as Plan B or the morning after pill, was made available on store shelves rather than behind a pharmacy counter and can be sold to anyone without an ID and regardless of age or gender.
In 2013, 3 radical Black organizers, Alicia Garza, Patrice Cullors, and Opal Tamati, created a Black-centered political will and movement building project called #Black Lives Matter.
In 2015, Obergefell versus Hodges was a landmark civil rights case, which the Supreme Court of the United States ruled that the fundamental right to marry is granted to same-sex couples.
In 2018, after a campaign led by Sister Song, North Carolina joined 20 other states with legislation prohibiting or restricting the shackling of birthing inmates during labor.
In 2018, a record-breaking number of women were elected to office during the midterm elections, of which 84% were women of color. All right, so I know we are very much at our time here, but I would like to leave, well, first of all, I'm gonna hand it over to my team council members to leave their closing thoughts on what the future of reproductive justice looks like to them. And then I'm happy, if anyone wants to ask questions afterward, I'm happy to stay on, and I'll also throw my email in the chat in case you want to message me. But I'll hand it over to any of my team council members if they want to talk on what does future of reproductive justice look like.
I can start. I think for me, one thing that would be important in a future of reproductive justice would be that forms of birth control are accessible to everyone. So like getting access to the pill would become a lot easier for women in America.
The future for reproductive justice looks like a lot of things for me, but I think a lot of it is just empowering and having like a lot more like safe spaces and things like that for marginalized communities of all kinds. And also I would love to see more, like especially in Kentucky, more community and like joint efforts between rural and urban areas, and between like Louisville and Lexington and Appalachia and all of those, because I think everyone around Kentucky has more, they have more in common than they think, and it's just not talked about enough. And I think a lot could be done if we had more conversations like that.
Okay, I can go next. The future of reproductive justice looks like to me that Black women are, well, as a Black woman myself, Black women wouldn't have to over advocate for themselves when it comes to giving birth, and that doctors will have basic resources and provide basic healthcare to them. Adequate, I mean.
Absolutely.
What reproductive justice looks like to me is everyone getting educated on what it is and understanding their rights to their body, their rights to how to raise their children, and understanding they do have rights to do so to oneself. That is what reproductive justice looks like to me, with it being connected with so many things, specifically / generally. That's what it looks like to me.
Awesome. Well, all of you, all my beautiful, wonderful team council members always, but also this conversation and hearing for y'all and seeing this kind of multi-generational conversation is, to me, reproductive justice in action, for sure. So sorry to take you to the very edge of time here. Happy to stay and chat, to answer questions. Feel free to email me. I do want to highlight all this beautiful art you're seeing throughout is from this very cool project called the Repeal Hide Art Project. It started out with that name, Repeal Hide, and they've expanded to all these RJ topics. So in that, it's really beautiful, cool artwork. And yeah, happy to hear closing thoughts. Happy to say goodbye. I'll just pass it over to our coordinators here. However y'all want it.
Is a Repeal Hide sticker available, or banner, or T-shirt, or anything?
Yeah, if you go to their, if you look up the website, you can order things. And I can help, I can email that to your coordinators here, staff at the church, send out a link to the website where you can like purchase things. But they have so much beautiful artwork that just captures so many of these topics and sentiments.
I put the link in the chat for the
Oh, Lexi, you're so on it. Thank you.
Can I just add, if you're sending stuff, one of the things we didn't get to talk about is what Planned Parenthood does besides, I mean, focused a lot on, people think of it as abortion, but Planned Parenthood does so much more than that. I don't know if you have a fact sheet about the kind of services you provide or something like that, I think is helpful for people to understand that it meets such a need in the community besides just being an advocate for abortion.
Yeah, I mean, of course we have the website, which goes into all the details. One of our newest services is actually hormone therapy. So that's gender affirming therapy. So I think a lot of folks know, we have birth control methods, screenings for, specifically cancers affecting our reproductive and sexual health organs, testing and treatment for STIs. So a lot of those basics, and you can get all that information on the website. I know we've got like the hard copies too, but one of our newest is that gender affirming therapy, so hormone therapy for transgender folks, which is a really excited new addition. I don't know if Tamari's there still, if she wants to add anything to
Yeah.
about that.
The one thing that none of our like pamphlets and stuff really talk about though too, and I think it does equip you, is that we are a frontline health center, and sometimes we're the only healthcare provider that individuals are going to. So we do have to do screenings, be a baseline, do healthy sleeping, smoking cessation, screen for domestic violence, screen for diabetes, high blood pressure, high cholesterol. And so we're doing those services as well, and making sure that people are then put into care if something comes back. But for most people that come through us, we are their only provider. And so we have to make sure that we are providing whole health.
I did have a question in the chat earlier about how we get our presentations or how they educate. So oftentimes they're just talking to friends. We facilitate lessons at a lot of the schools that the members go to. But we're always looking for new groups. So if y'all are interested, definitely reach out. Be happy to come talk to any groups you're part of. It really helps when we have parents, grandparents, whoever advocating at schools, because schools get a little nervous. They'll get in trouble for having sex ed, and hearing from those adults that this is wanted and needed eases their mind so that they can offer more of these programs and information to their students.
Yeah, and I'll say too, sex education is widely popular. It polls it in Kentucky at 83% favorability. So it's normally a very vocal minority that would be speaking out against us. It's a very popular topic that breaches divides.
What's not to love,
Right?
As you can see.
So next week, I'll be on the panel for your last session. And if some good person in St. Andrew asks me, I will tell you one of my stories about sex ed in Kentucky.
Now someone's gonna have to tell me about this one.
No.
So, I'll look on the website for the YouTube video.
You call me and I'll tell you. Just I'll
Yeah,
give
we
you
love our sex ed stories.
private story.
There's a lot of great ones out there. That's some myself.
All right, I want to thank all of you from Planned Parenthood for this excellent 2 hours or hour and 40 minutes. And I don't mind going over at all. I don't know if we lost many, but I hate to see it ended. I'm learning so much, and I'm feeling as if there is a community growing of like-minded people who would like to make a difference in relation to reproductive justice. Many who have not wanted to talk about it before. So thank you very much. And to everybody, next week is our 4th session. And we have the Reverend Wayne Gennady, whom you can see on your screen right now, as a retired Presbyterian minister and the present director of the Kentucky Religious Coalition for Reproductive Choice. We have the Reverend Elwood Sturdivant, who is a retired Unitarian Universalist. We have Reverend Lauren Mayfield, who is an associate pastor at Highland Baptist. And we have, who's the 4th?
The 4th is Cantor Sharon Hordes.
That's right. I'm sorry, Rabbi
Yes,
Sharon Hordes, who is cantor at
Knesset Israel.
Knesset Israel synagogue. Yes. So we should have another great conversation. And we invite folks from Planned Parenthood to come and be a part of the audience and therefore a participant in asking questions of this panel that we've put together for next Monday night at 7:30.
That's great. I will definitely send the link to the crew. We're also hoping to do what we call a friends and family night and talking more about reproductive justice. So once we have that, I will send the information to your all's organizers to send it to you. And I just want to say how meaningful, I know everyone is always feeling inspired by youth, but it is so powerful for them to hear from you all. I mean, it truly, for them to feel the support like that is really, I think, a lot more meaningful than you may realize. And so we just want to thank you all for all of your work.